So you can see here I have drawn this posterior border of the maxilla, tuberosity, crest of the ridge, again tuberosity, and the posterior border of the maxilla. So now this is the entire maxillary bone. Okay. Now if we go to measure and say, oh wow, there's some good height here, 11 millimeters. This looks to be an easy case, right? But we're looking at the OPG. Now we're looking at the same thing in the CBCT. This is the patient's CBCT. Very poor quality bone. Can you see that?
Yep.
Absolutely everything is D4 or even possibly worse than D4. And what about the width? Can you see this now?
Oh, no.
Knife edge.
Yes.
So this is what happens when you only evaluate from an OPG.
So this case can either be done freehand, or if you're a beginner, then we can do a surgical guide planning using various surgical guide software. The softwares are very versatile and you can plan the implant placement in great detail, taking into account the prosthetics and the surgical requirements of the case. So once we are fully planned with the case, then we can try on the surgical guide. In this case, I'm doing a demonstration for a course. So of course I won't use the surgical guide. Here we are going ahead and freehand placing the pterygoid implant. We have a detailed demonstration on how the pterygoid implant should be placed. Then I'm going to do intraoral welding to stabilize all the implants together, and then show you detailed prosthetic steps on how to pour the model when we are taking direct impressions with intraoral welding. Basically, the abutments and the welding wire must be recorded very nicely in an alginate impression and poured using pattern resin and stabilized using the metal pins. These metal pins anchor into the pattern resin and then into the cast. Once the model is ready, then we have to put on a surveyor and check for the parallelism and prepare all the abutments to make them parallel. Once that is done, then we convert the case into the digital route way, and we do a scan of the models, and we go ahead with the digital designing of the entire case. Once the designs are ready, we then mill the design in PMMA, high strength PMMA, and this is going to be used as our provisional prosthesis for the next 6 months. Now, as we saw before, the lab had made some changes to the abutments. So now the lab will also make this preparation jig so that I can make the same changes in the patient's mouth. He will polish the PMMA, and along with this transfer jig and preparation jig, he will send me the finished PMMA and the jig. This is the implant that has been inserted, right? Going through this area and engaging here. This is the area in the tuberosity that was there. This is the posterior border of the maxilla, posterior border of the tuberosity, and this is here the cortical, and the cortical, right? This is the lateral pterygoid, this is the medial pterygoid, this is the hamular process, okay? So this implant has gone through this junction and engaged all this bone, okay? This is the upper cast. So he has prepared this modification jig for me. You see that? Pterygoid a little bit I have to prepare here. A little bit even this one I have to prepare, even though we cemented the angle abutment. Still he wants me to prepare it a little bit. And a little bit for these implants in the anterior part. So first I'm going to take the preparation jigs and place them in the patient's mouth and prepare the abutments in the mouth exactly as the lab had prepared them. Then after that, we're going to take the provisional prosthesis and try them on. And here we have a happy patient in 24 hours from no teeth to fixed teeth.